So I'm joined by Stephen Brown, NHS Consultant up at Sheffield, and we just want to discuss a little bit about pilonidal sinus and just the general state of pilonidal sinus disease. And the whole point of this website and this project is to raise awareness for aftercare and how surgeons currently view pilonidal sinus in the UK. So firstly, overall thoughts on pilonidal sinus currently in the UK as a whole, just your general feelings towards it.
Well, it's very important. It's common. It tends to affect a group of young people that are socially active, that are working, and therefore it can have a massive impact. Even though it perhaps doesn't seem such a sort of serious disease, it can really affect quality of life.
Is that probably the biggest thing you would say with pilonidal sinus disease, is that people aren't actually aware of the quality of life aspect? Where, you know, when I was, obviously this is from my perspective, when I had my first surgery for it, I was told the stuff, I believed in what I was told, and I thought, okay, 3 to 4 weeks, like they said, I'll be back on my feet, playing football, you know, socialising as you think you would. Do you think the quality of life aspect maybe gets overlooked at the beginning?
Well, I think there's a definite absence of taking into account what the patient wants and how it affects their lifestyle. There are so many different varied operations and so many operations that are favoured by some people that aren't necessarily the right thing, some surgeons I should say. And I think there's a desperate need for surgeons to appreciate how much impact it can have, and different operations might suit different patients.
Yeah, 100%. We're going to touch on that shortly because that's a really important point that obviously Dr. Carapetti spoke to me about in detail, about the different types of surgeries that are probably the most suited to different patients. Like, it really isn't one case fits all. In terms of awareness in general for pilonidal sinus throughout the UK, do you think that there's enough awareness for the disease in general? Do you think there's enough information out there for, you know, patients or surgeons to find the information for?
Well, I guess if you take it from a doctor's perspective, in primary care, GPs perhaps are aware of what pilonidal sinus is, but they don't necessarily treat it right. They don't refer in perhaps early enough. There's a tendency to treat with antibiotics, and that might go on for several months before the penny drops and the GP thinks, I need to refer this in. From a surgical perspective, I think there is a tendency, and I hate to say this because there's some great surgeons out there, to put this, for want of a better term, it's not a sexy condition.
Yeah.
You know, we don't spend a load of time learning different techniques, complex surgery. It's pretty simple surgery.
Yeah.
And colorectal surgeons therefore don't pay as much attention as they should. They tend to pick up on one particular operation that they've learnt in their training and just stick to that operation and think it's a fix-all for everything.
Yeah.
They tend to put these smaller cases, they don't take very long to do, in the middle of bigger cases, so the focus is on the bigger cases on the list rather than this as being sort of an important thing you need to take your time with. The other trouble is that pilonidal sinus disease, it tends to be referred to colorectal surgeons who deal with bowel conditions. And this is a skin condition. And I don't know why it always has been the case that it comes to us.
Do you think it's just the area that it's in,
Yes.
it kind of like semantically related?
It's close to the anal canal. There are other conditions that can mimic pilonidal disease. But on the whole, I just wonder whether plastic surgeons might be a better professional doctor to be looking after this, because they love skin conditions.
Interesting. Yeah, I think, as you say there, the type of training, or, you know, how people were taught to treat pilonidal sinus for patients is completely different, because a lot of the time it's like see one, do, I can't remember what the phrase is, like see one, do one, teach one, yeah. And I think that probably applies to pilonidal sinus quite a lot, which is obviously, as we were talking about, quite an issue because every patient has a slightly different approach to how it probably should be done. Why do you think that it is that it's kind of like, I don't want to say disregarded, but maybe not the favoured or the sexy one to do? Is it just because it's maybe low maintenance and people think that, you know, people could just get on with their lives with it while having the condition?
Yeah, well, it affects a young group, so you think, well, they're going to respond to treatment a lot better than the elderly patient. It doesn't require complicated surgery, or at least that's the perception of a lot of doctors, and therefore they don't pay too much attention to it. But actually, it is quite a difficult condition to treat. And we don't really, and the problem with the research and the evidence out there, we don't really stratify disease. We don't really think, well, this is bad disease, this requires a more intensive treatment, and this is not so bad disease, this could get away with minimal treatment. You don't speak to the patient saying, what do they want? Do they want to trade off an operation that is big but may have a higher chance of success versus an operation that is small means that the patient get back to normal activities faster, but they may have maybe a high recurrence rate.
Maybe, I don't know if this is the best word to use, but would you say it's been slightly neglected as a condition throughout the UK by the NHS in general? Because not in terms of, actually treating patients that need the treatment, because when I went through it, the treatment was always there, but in terms of having the mindset or the approach to know what is best and confidently, I think that's the most important thing. Patients have the most confidence in any surgeon that they will speak to when they go into a hospital. By the time I'd got to my 5th surgery, I just lost complete faith in what I was being told. So in terms of that aspect, do you think that's maybe missing at the moment?
I do. To be fair to the NHS, they have realised this, and I've been involved in a big study called Pit Stop looking at this disease. So the Department of Health paid for this research to be done, looking at the real world treatment of pilonidal disease. And that was very interesting, very revealing, because we also looked at the training that surgeons were getting. It wasn't brilliant. We looked at the fact that patients weren't being asked what they wanted. They weren't being offered different treatments. And as I mentioned before, surgeons seem to have a one operation fits all that they learned from their mentor, their surgical trainer, that persists. And there is a desperate need for better training, a desperate need for appreciation of what patients want.
Aside from kind of the surgery, the biggest thing I found was maybe the lack of information or guidance around aftercare. So what to do once you actually leave the hospital. And some people are left with massive open wounds that they have to deal with. Some people might be on their own. Luckily, I had my mum to kind of help me with the treatment of that. But some people might struggle with that. They might live by themselves. They might have to just get on with things.
It's not an easy area to see.
Exactly. It's really not. And there's a few specific things I was told by Dr. Carapetti on my last surgery that were completely different in terms of how the aftercare should be, what you should and what you shouldn't do. Do you think that's maybe one of the biggest issues as well? Not just aside from kind of the surgery options or the lack of knowledge for what's best to do for certain patients, but the actual aftercare in place from general practitioners, nurses, that kind of stuff.
Well, in some ways, it shouldn't be a problem, aftercare. It should be pretty straightforward, because if you do the right operation, you don't need much in the way of aftercare. It's when things go wrong or when you've had the wrong operation that you need a lot of aftercare. So if somebody has undergone an operation where they've just simply excised the whole area, they've made the operation worse than the disease itself. And that requires intensive nursing care. I don't think we're absolutely sure what that intensive nursing care is. I think it involves intensive nurse support and regular review. So in our hospital, if we're in that situation where things have gone wrong, we've inherited a patient where there is an open wound, we tend to see the patient in the hospital on a regular basis, because we think community nurses won't be so aware of what is needed, and the patient needs a lot of support. So that's what we tend to do. Other hospitals, I suspect you'll just let loose into the community and told to fend for yourself.
Do you think maybe that's the best approach for aftercare, is not actually, the surgeons themselves, I think, are obviously, I would say, less empathetic than, say, a nurse would be in terms of the aftercare and the approach and the kind of emotional or mental side of what would happen post-surgery. So in terms of the aftercare training or knowledge across the UK for these kind of nurses and GPs and doctors, do you think that's probably the best approach to take in terms of, we need to train the actual nurses on this rather than maybe putting the strain on surgeons in the NHS, who are obviously going to be very busy with other stuff as well?
Well, I think specialist nurses, so that's why we tend to use our hospital nurses to deal with problems like that. But I go back to the fact that if you do the operation properly and don't do the wrong operation, you shouldn't need much in the way of aftercare, and you just need support for when things go wrong. So for me, the priority is to get surgeons to do the operation right and do the right operation. And along with that, talk to the patient about what they want, give them as much detail as you possibly can about the various options that should be available, and surgeons should have more than one option. So I think that would avoid the need for intensive aftercare afterwards. But if you do need it, for me, it's done by a nurse that is familiar with this and regular input from the surgeon. The surgeon should be as empathetic as the nurse in this situation. I know for me, I would always consider the need for intensive input to a patient's aftercare as something that's gone wrong, and I'm very empathetic because something's gone wrong because of what I've done. So I really am very conscious about those small group of patients that I've got.
Yeah, 100%. I think The general feeling from my point of view, but obviously being a patient that kind of suffered with this for 18 months, is the mix of information. I think that's probably the biggest issue I found, because you can search things online, you'll get websites that generically talk about pilonidal sinus, but again, information is quite conflicting online. People have different views, there's different treatments available, like you said, and people have different resources for aftercare, etc. So how do we get to a point where that isn't the case for a patient? What do you think is the best approach to take in terms of that?
Well, what you're doing is brilliant, having a patient forum so that you can discuss what you've been told and the various options, and actually identifying surgeons with an interest in this area, because there are some surgeons that are brilliant in the UK at dealing with pilonidal disease, and finding out who those surgeons are is really difficult, but a forum like yours might be able to reveal that. And I think just having intense hospital follow-up for these patients is important.
Yeah, 100%. Okay, we'll wrap this up with one last question. Maybe slightly more difficult to answer, but if you could pick maybe 3 things to do, going forwards for pilonidal sinus disease in the UK to improve, what are those kind of 3 main things that you would summarise to other patients or doctors that are watching this?
Well, one thing I haven't mentioned actually so far is research into pilonidal disease. Yeah. There's a lot of papers out there, not very good papers. That's why you're getting, and you're getting so many conflicting ideas about things. So I think we need to improve research, and that's certainly where the pit stop is taking us further forward. So we need to be able to look at what sort of interventions in aftercare will make a difference. Shaving the area, different types of wound dressings, whether they will make a difference. What sort of operations we should be doing. Patient-reported outcomes is essential, so patients telling us what they want. I think training needs to be improved, so that surgeons are aware of the different options that are available. And I think what you're doing today, making patients aware so that they can find the right surgeon to help with their problem.
Amazing. Yeah, Stephen, thank you so much for that. I really appreciate it. And yeah, we're going to be bringing out a lot more content on the channel and the website in due course. And yeah, hopefully we'll start to build out that network, like you mentioned, for forums and stuff like that, and also kind of the top doctors in the UK or surgeons in the UK to refer to. So yeah, make sure to check out Stephen's stuff. I'll leave a link to his website stuff as well, if you want to get in contact with him, if you have any other further questions around this. And yeah, Stephen, thank you very much.
Thank you very much, Frankie.